Hello, good morning, friends, and my dear parents. You must be aware that now, again, some information about the pediatric patients with the coronavirus. There are some new signs are coming up, and as it is more promoted on the newspaper and the TV medias, so you also might be aware that there are many children who are affected with the new type of the presentation. So far, as per the information, somewhere around 150 to 160 children are affected with the new type of the presentation, which is known as Kawasaki disease like illness. Okay, so you might be have the questions that how it is and how we recognize them. As we discussed previously, like the coronavirus has a very mild course in the pediatric patients, but this illness is little bit severe, but fortunately the incidence means the number of cases are very less. So first, now I will describe about the what is Kawasaki like illness, what are its signs and symptoms, and how you recognize it. So first of all, for any Kawasaki like illness, the fever to be there in almost all the children, like whoever has presented with the Kawasaki like illness has the fever of minimum 5 days duration. It will be high grade fever ranging somewhere around 39 to 40 degree and will respond less with the paracetamol. As soon as the effect of paracetamol will go down, again fever will start coming up. Don't use more of the ibuprofen or the Voltaren suppositories or the diclofenac suppositories, because sometimes it can cause a problem with the illnesses. Second thing is, you will see the redness over the eyes. The white part of the eye, you will see the red, but there will be no any discharge. That means there is not a proper conjunctivitis, it is just the redness over the eyes. Third thing is the skin rash. There are different type of the skin rashes are there in the Kawasaki illness. So most common rash which we are seeing over the hands, legs and over the body. It can be like the small droplet, like the small round type of the skin rash, or maybe it involves the whole body. Sometimes the swelling over the fingers and the legs also can be there. Fourth feature is the red tongue. The tongue will be red, very red. It will be almost like the strawberry color tongue. Last one is the lymph nodes. Most of the time the lymph nodes around the neck are involved, so you can see some swelling around the neck, which might be little painful or not painful. But for all these features there should be a fever. If there is no fever and only one things are there, like there is no fever but the eyes are red, no fever but the skin rash is there, then it is unlikely having the Kawasaki illness. Now generally for the routine normal Kawasaki diseases, the age group is almost 1 month to 5 years of age group. But with the coronavirus and the Kawasaki, age group is somewhere around 3 years to 7 years. So far, as I told, 150 to 160 patients are reported all over the world. Many cases are from the Italy, some cases are from the UK, and some cases are from the USA. And there is little mortality. I think only 1 or 2 kids are expired in the USA. But overall, very few patients require the intensive care unit hospitalization. If the child presents with all these symptoms, then the treatment is little bit easy. But if child present with the fall in the blood pressure, which we commonly known as a shock, like when the child will get dehydrated and the blood pressure will start falling up, then the child went into the shock. That is known as a shock-like condition. Kawasaki disease with a shock-like condition is always a serious condition, and the child deteriorate very fast. So treatment-wise, mostly are the symptomatic treatment, like the fever medications, IV fluids. If the blood pressure goes low, then the IV fluid to increase the blood pressure. Some of the children requires the intravenous immunoglobulin, and some of the children might require certain medication like the aspirin or the clopidogrel. So friends, don't get panic with the new information, because the incidence in children is very less. They are not very severe, but very few patients are getting severe. So spread the positivity, stay at home, stay safe, wash your hand frequently, keep the face mask always on, don't let the children go out and play in the play area, keep a distance of at least 6 foot in between the children, and let's come out of this situation, and we again will have a happy world. Please like it, share it, and subscribe it. Thank you very much.